So a warm good afternoon to all of you. Today you are going to learn regarding essential newborn care. Okay. Then also regarding IMNCI, then IYCN, and okay, also the National Immunization Program. Now the essential newborn care, very important, very simple. Okay. So neonatal care. Okay, neonate means what? Group is less than 28 days. Okay, so in that, general hygiene, it is necessary to clean one's hands and legs properly before handling the child or before bathing the baby. So whenever you want to handle a newborn, the handler must have to wash his hands, feet properly. Okay, keep a clean cloth on one's legs while bathing the child. Mother should not wash the breast before every feed. Now, why? Mother should not wash her breast before every feed, because if she always washes her breast before feeding, it will get cracked. Okay, the skin becomes dry and it will get cracked. So the mother will get cracked nipples. Also, while feeding, the hormones which are there in the nipple or areola, that hormones smell draws the infant or baby to mother's breast. Okay, so the hormones which are released by the breast, so those hormones are accumulated around areola and nipple. So the baby draws towards those hormones. Okay, then nails should be properly trimmed. Then everybody handling the child should maintain proper nail hygiene. Baby's overgrown nails should be cut properly regularly with baby nail cutter, which is available in the market. Also, the scalp, do not heavily massage or patting with oil on scalp. It closes by itself by 18 months or so of the age. The anterior fontanelle, which is open because of the skull bones yet to mold. Okay, so that gets closed on its own as the baby grows. Okay, so by 1 year or by 1.5 years, it gets closed. So do not heavily massage or patting with the oil on the scalp. Nose and ear, do not put oil into child's nose or ear. If you put oil in baby's nose, can cause oil pneumonia or ear, or it may block nose, or in the ear it may damage the ears. Okay, mouth, do not clean child's tongue, mouth with glycerin, because some whiteness on tongue in is natural because of the milking. Okay, baby always drinks milk, so some whiteness will remain. Okay, but it does not interfere with feeding. It's normal and natural. But spotty patchy white deposits on tongue and all over the mouth are because of the oral thrush, also known as fungal infection, which needs treatment. Vagina and breast, due to mother's hormones, baby's breast tissues may get enlarged or may start secreting milk in girls, also boys. Also, because of the hormones, the female child can produce vaginal bleeding lasting for 1 to 2 days. These are absolutely normal. It is because of mother's hormones. So at that time, we should make the parents relax. Right? Then bath, do not bathe the baby soon after birth. It lowers the baby's body temperature. So at home, do not apply turmeric, gram flour or milk cream on baby's skin, because it may cause in infection, recreate or body rash. Okay, and do not try to remove the baby's body hair they will fall off on its own. It is known as lanugo hair. This lanugo hair fall off on its own. Within 1 to 1.5 months, these lanugo hair fall off on its own. So do not scrub besan vagara on the skin. Use any mild soap and all. Umbilical stump. Clean the umbilical stump with water and soap while bathing and keep it dry always. Okay, then do not apply boric powder as well. Now, do not oil massage. If at all you want to do it, do it properly. If at all baby has a rash, stop it. Okay, eyes. Yeah, in the eyes, use kajal is dangerous. It may contain lead, which causes lead poisoning. Also, the kajal particles may cause blockage of the nasolacrimal duct. Nasolacrimal duct. Okay, causing persistent watering of eyes. So, because of the use of kajal, the nasolacrimal duct gets blocked, causes persistent watering of eyes. So, avoid it. In the adult age group, it is okay. In younger age group, since the duct lumen is also narrow, for that we should not apply it. Yeah, smoke. Do not burn smoke producing substances to give heat fermentation to baby or mother. Okay, because the baby may suffer from cold or cough. Okay, do not try to stretch baby's upper or lower limbs because the child is unable to strengthen its limbs till 3 to 4 months of the age. Okay, also do not tie the head around child's neck, waist or wrist. Why it is so? Because as the child grows, okay, as a child grows, the head will become tightened, okay, and may cause damage, also injury to baby's neck, waist or wrist. So don't do that. Clothes, you should always apply simple cotton clothes to a baby. Okay, also never should overwrap or under clothe the baby because overwrapping may cause fever, whereas under wrapping or under clothes can cause hypothermia in the baby. Okay, because baby's thermostat mechanism is not yet established in the brain. So baby easily gets hypothermia and all. So never underclothe the baby. Okay, nappies and napkin rash. Nappies can be prepared at home with cotton cloth. Okay, changing a nappy as soon as it gets wet will prevent a nappy rash. Ready-made nappies should be avoided because it always causes rash. That is all. Okay. Let us learn regarding IYCN, means infant and young child nutrition. Infant and young child nutrition means IYCN. Okay, it is defined as nutrition and feeding of the child from birth till her birthday. Okay, and it is also included the appropriate nutrition supplementation of the pregnant as well as the lactating woman. Okay, so IYCN includes nutrition of newborn till 3 years of age along with nutrition of pregnant and the lactating mother. Okay. Now we have the 4 recommendations of the IYCN. These four recommendations of IYCN you must know very well. Simple, easy, yet very important. First one is to help mother to hold the baby in close skin to skin contact within about 5 minutes after birth. Okay, as soon as the baby is born within 5 minutes, advise the mother to hold the baby skin to skin. Okay, then exclusive breastfeeding from what till completion of 6 months. Exclusive breastfeeding till 6 months of age. Introduce appropriate hygienically prepared homemade matched complementary food in adequate quantities at the end of the 6 months and continue breastfeeding at least second birthday. Okay, now introduction of this hygienically homemade complementary food. Now, this food is in complementary to the breastfeeding. It is not a replacement. It is complementing to the breast milk. So, at least till 2 years and at the max till 5 years. Mind you, at least till 2 years and at the max, at least till 2 years and at the max till 5 years, we should advise mothers to breastfeed the baby. Okay, up till 6 months, exclusive breast milk, and up till 5 years, minimum at least once, especially at night, feed the baby. Okay, advice like that. Also, we should advise about interactive feeding. Means what? That converse and communicate with baby while feeding. It is known as interactive feeding. Always we should advise interactive feeding to stimulate the mental as well as the emotional development of a baby. Okay. Then this is a very important, very popular pie chart. This is a relation between under 5 mortality rate and malnutrition. Mal means bad. Bad nutrition means undernutrition as well as the overnutrition, obesity as well. Okay, but when we talk about this pie chart, it is predominantly undernutrition. Okay, so relationship between under 5 mortality rate and malnutrition. See, if in this pie chart you will see 50% this is 50% mortality is because of the acute respiratory infection, which are pneumonia and all, diarrhea, measles and malaria. 50%, 19% ARI, 19 diarrhea each, measles 7 and malaria 5%. So it costs around 15%. Okay, so 50% mortality is because of these 4 diseases, including malnutrition, which is in the center. So all causes means other as well as perinatal causes. These all included. Okay, so in all these causes, underlying malnutrition is commonly observed. Okay, so here what we can see is 55% children are malnourished, means undernourished. So this is the relationship between under 5 mortality and malnutrition. Very important. This is where we stand. Okay. Now, malnutrition in the intrauterine period and in the first 3 years of life is commonly seen, and because of which what effects we got. Okay, the ill effects of this malnutrition in intrauterine as well as first 3 years of life, we get immediate as malnutrition, illnesses, and growth faltering. Long term, our individuals are deprived from reaching their highest level of physical, cognitive, and reproductive development and human potential. Okay. Long term, our individuals are deprived from reaching the highest level of physical, cognitive, and reproductive development and human potential, and overall affected the health for entire life. Next generation, malnourished mother gives birth to a malnourished baby, and the intergeneration cycle of this malnutrition continues. So to stop this vicious cycle, we must give proper food and nutrition to the young children, young girls especially, okay, who would be mothers. Now LBW I think is done. KMC, kangaroo mother care. So for low birth weight babies in Colombia, okay. So components of this kangaroo mother care is skin to skin positioning, adequate nutrition, ambulatory care since early discharge, and support for mother in caring the baby. Since mother will be taking care of baby into skin for more than 18 hours, the community has to support the mothers. Okay, in that the intensive care we have, which is incubatory care in form of adjustment of temperature, humidity, and oxygen supply, because lower level of oxygen results into cerebral palsy, whereas higher level of this oxygen results into a retrolental fibromyalgia. So we have to adjust the oxygen supply. Okay, feeding that since the baby is lower weight is less, breastfeeding is not easy. So this breast milk, if at all it is available, use by the nasal catheter. Prevention of this infection we do with the help of death. It occurs, death within few hours occur because of the respiratory infections. Okay, the leading causes of this mortality in this age group is atelectasis, malnutrition, pulmonary hemorrhage, intracranial bleeding. Okay, also pneumonia and so. Now this IMNCI, this integrated management of neonatal and childhood illnesses. The major stakeholders are WHO, UNICEF, and other international partners. An effort to bring health equality for child health, emphasis on integrated approach for treating the emphasis on improving the family as well as community practices and care provided by us for better care of the baby. Why it is integrated? Because we have some 5 diseases which are commonly observed. Okay, so we integrated now same pie chart which already we saw. Okay, so where we can see that malaria, measles, diarrhea, pneumonia causes 50% of mortality in Antopy along with malnutrition. So these 5 diseases, pneumonia, diarrhea, measles, malaria, and malnutrition, they one of the other at a time a baby is having more than one disease. Fine. So we have the integrated approach so that at a time we can treat more than one disease of the baby. Yeah. So as I already explained you, it is child centered like pneumonia, diarrhea, measles, malaria, and malnutrition. B, D, and triple M are major cause of mortality. 3 out of 4 children seeking health care in developing countries suffer from one of these conditions. Children likely to be suffering from more than one condition at a time. As I already told you that when baby is with us in the OPD, in the PHC or UHC, baby is having more than one disease. Okay, and often combination of these conditions lead to fatal results, making a single diagnosis difficult because the baby is having multiple diseases. Such children often need combined therapy for successful treatment. So advantages of this integration is a speed up urgent treatment. Okay, prompt recognition of serious condition. It involves parents in effective care of the baby at home. It speeds up since there is multiple disease management at a time. It always speeds up the treatment. It involves parents at home care, prevention cases back to immunization, improved nutrition, and exclusive breastfeeding also is a major stakeholders to prevent a disease. It is very cheap because it is cost effective. It avoids wastage of resources. Okay, by using most appropriate medicines and treatment. It reduces duplication of the efforts. Repeated efforts are stopped. Then partial success of individual disease. And also in health care facility, even a healthcare worker who is not doctor can always manage the baby because the protocols are always on the wall, stuck on the walls. Okay, so how to manage a baby? Protocols are always in form of a flow chart is stuck on the walls. Now, single diagnosis is inappropriate. Why? Because sometimes what happens if a baby is having cough or fast breathing, and that time baby might be having pneumonia, severe anemia, or just fast breathing. So, for one symptom, there might be multiple diagnoses. Okay, so fast breathing, a baby has might be because of pneumonia, severe anemia, or just because of fast breathing. Okay, unconsciousness or lethargy might be having because of cerebral malaria, meningitis, severe dehydration, or very severe pneumonia. Measles rash may occur because of pneumonia, diarrhea, even the ear infection, or very severe infant is because of pneumonia, meningitis, or sepsis. So these are the possible causes or associated conditions because of which a single diagnosis is inappropriate. Now, a component of this is WHO has got IMCI, Integrated Management of Child Infection, whereas India is having Integrated Management of Neonatal and Childhood Illnesses. So, neonatal compound is included only in India. Okay, in WHO it is always IMCI. In India it is IMNCI. Okay, it is the most effective when all three components are implemented simultaneously. Okay, they are integrated management of childhood illnesses, their health system strengthening, and community IMCI or promotion of key family practices. Okay, so integrated management of childhood illnesses, health system strengthening in form of training of the healthcare workers so that if the doctor is not available, even a staff nurse or village health guide will also will able to manage the baby, right? So it is most effective when all these components are implemented at a time. Now this is IMCI case management, first level facility and referrals. So we should know where the referrals are available. Fine. So in the first level health facility, we have a general danger signs. So when the baby is with you in your OPD in BHC or UHC, and at time first check out for the general danger signs, then assess for cough or difficulty in breathing or diarrhea or fever. Okay, at a time assess for malnutrition as well as anemia and check other problems. Right? Then classify the baby's condition accordingly, pink, yellow, and green. If the child is severe, needs referral and it is pink instead of red, it is pink. Then if the baby is able to manage at the PHC or the UHC level, it is a yellow. Means where we give the specific management and leave the baby. If the baby is able to manage at home, ambulatory treatment, okay, at that time, give medicines and let the baby go. And accordingly, if the baby is in danger zone, Advise parents about the referrals and their refer the baby. If baby is in yellow or green zone, then teach the parents about management, counsel them about feeding and when to, very important, when to return feeding practices, and also when to return means how to identify the danger signs, and then home and family management at home. The difference between IMNCI and IMNCI. See, in India we have IMNCI, whereas in the world we have IMCI, where 0 to 7 days period is covered in IMNCI because maximum mortality occurs in this age group in India. Okay, India observed or India experienced maximum mortality in first 7 days of life. That is why we included IMNCI, Integrated Management of Neonatal and Childhood Illnesses. So first 7 days is very important. Then basic healthcare module, which is included in IMNCI. Then home visits by provider is also included. So in India, the home visits are there. Health care provider visit the house of a newborn baby. Then there is a training for home-based care under IMNCI. Then total training for health care workers, which lasts usually 11 days. Out of that, 4 days is for the neonatal age group. Okay, so 2 days extra we have for this age group. So these are the factors because of which we have IMNCI, Integrated Management of Neonatal and Childhood Illnesses in India. And then sequence of training in IMNCI discuss newborn and young infant 0 to 2 months training, followed by from 2 months to 5 years of age. Now, why it is? Because maximum mortality occurs in 0 to 2 months of age. So, while training the healthcare staff also, we have first 0 to 2 months, then next age. Yes, in this package, what do we have? So care of a newborn and infant under 2 months, keeping the child warm, very important. Initiation of breastfeeding immediately after birth, and counseling for exclusively breastfeeding. No pre-lactate is very important. Cord care, skin care, and eye care. Recognition of illness in newborn, management and all referral, and also immunization. And so this is the care of infant under 2 months of age. Then in the home visit of PNC woman postnatal period, the Anganwadi workers or the auxiliary nurse midwives does the home visits by health workers. 3 home visits, day 1, 3, 7 to every newborn. So in first 7 days under IMNCI, we give 3 visits at age 1 day, 3 days, and 7 days. For low birth weight also babies, 3 more visits on day 14, 21, and 28. Yeah. Then mother care of mother during this period is also very important. Then from 2 months to 5 years, we have to manage diarrhea, AR, because it's very common. Same malaria, measles, malnutrition are coming. So these all are diseases commonly seen in this age group. At that time, we have to recognize and manage or referral the illness of at-risk conditions. At that time, same time, simultaneously, we have to prevent and manage iron and folic acid problems and feeding counseling for all children below 2 years of age. Okay, and also feeding counseling for malnourished children between 2 years to 5 years of age. Also immunization. So these are the care component of a child from 2 months to 5 years of age. Now, who provided the health care workers? Improvement in this health system is essential element include availability of health workers at all levels. Very same time available of the essential drugs can improve referral to identify the referral facility. Then awareness of health worker for when and where to refer. The healthcare worker should able to identify the danger signs and they should be knowing where to refer. Okay, the staff should give the priority care to the sick children. Then supervision and monitoring through follow-up visits must be there. Functioning referral centers, especially where the healthcare systems are weak, needed to be reinforced. Public-private partnership, okay, should be established. It should be the on-the-job support and supervision. So hands-on supervision is must. Then improvement of family and community practices, counseling of families and creating awareness among communities, which include promoting healthy behavior, information, education, communication campaigns, counseling of caregivers and families during home visits, okay, identification of sickness and focused behavior change communication. BCC means behavior change communication. Collaboration and coordination with other departments. Okay, it is known as intersectoral coordination. It should be a community ownership and also the community partnership. Okay, participation of community is must. These are the management algorithms for the children less than 2 months of age, and also it will be for more than 2 months of age. Okay, so when we see the protocol for the baby less than 2 months of age, the integrated case management for the baby less than 2 months of age at that time. After seeing that, we have to proceed for the diarrhea, feeding problems, immunization, and other problems. Okay. Then same we have IMNCI case management for children between 2 months to 5 years of age. There also, after this, we have to main symptoms like cough, diarrhea, breathing problems, fever, and all, followed by look for or ask about or look for malnutrition, anemia, immunization, and other problems. So apart from the main symptoms, the other problems also you should ask for. Then we have facility-based IMNCI. Means what? Facility-based care for the severely ill children is complementary to primary care for providing a continuum care for severely ill children, especially where the pediatrician is not available. When pediatrician is not available at that time, we strengthen our care system providers by giving them the knowledge and training so that they will able to manage a severely ill children in PSC or in IMNCI. Right? So majority of health facilities do not have the in nutrition. So at that time, we do the skill building of the medical officers and the staff nurses posted to take care of the severely ill children in the PHC or IMNCI. Now in this training, we focus on the skill development, 50% of the training time is spent on the building skills by hands-on training. So we give them a hands-on experience, okay, hands-on training, and remaining 50% in the classroom. So in the training session, half of the is in wants hands-on, remaining half in the classroom. Okay, training is in two levels: service training and pre-service training for doctors and nurses. Person being trained are who are IMNCI and not trained and trained. The one who are not trained for them package to be uses if IMNCI complete package, which is 11 days. The one who is already trained for them a 5 days package. We do. Then training of trainers, facilitators, and instructions and service training, fine. Then we have community and household IMNCI. See, IMNCI means community IMNCI. It's a basically a component of this IMNCI. It aims at improving family and community practices by promoting those practices with greatest potential for improving child survival, growth, and development. Evidence that 80% of mortality of under 5 children occur at home with no contact with health providers. So majority mortality occurs at home where health care providers are not available. Okay, so the IMNCI 6 to strengthen the linkage between the health services and communities to improve the selected families and community practices and to support and strengthen the community-based activities. This is the household, like all we can do that we have to strengthen the linkage, improve the community and practices, and support the community-based activities, which we do in this form. Clinic outside, okay, then village shop, maybe we can give them education, then integrating and promoting key practices, okay, along with their nutrition. Now, there are 16 key family practices identified under the 4 broad headings. Now, what we can do, you can rejoin on the same link. Okay, I'll stop here.
Okay, ma'am.